Well, back to our top story, and health officials and scientists say they're increasingly concerned about the spread of the Omicron variant in the UK. The Health Security Agency says the variant can beat naturally acquired immunity and is theoretically able to evade the vaccine. Well, in response to the rising COVID threat, the vaccine booster campaign is ramping up with a focus on pregnant women, and over 1 million appointments already booked in just the past 5 days. Well, let's speak to a senior clinical lecturer at the University of Exeter, Bharat Pankhania. Hello, good morning, afternoon to you,
Hello.
rather, Bharat. So Plan B, you would like that to be rolled out, would you, in England, where we work from home, and that would be your hope?
Oh, it is my hope very much, but we should have been acting on this a little earlier, even when the Delta variant was in widespread circulation. Really, the science is very, very simple. The science is very simple and straightforward, which is you suppress the number of cases, you do all you can to reduce interactions with fellow human beings, and that way you preserve the number of cases, the school outbreaks, the hospital admissions, the ICU admissions, and the deaths. It's as simple as that. You keep the case numbers down and the other things follow.
What would be your advice then, Bharat, for people heading into this festive period and do have the green light at the moment to mix with as many people as they like?
Well, the straightforward advice I would give is make sure you're fully immunized, because the vaccines do protect you were you to encounter the virus, and also the booster, because we've got a new variant in circulation who may theoretically be bypassing vaccines. It looks very likely that that will be so. So please update your vaccines. Furthermore, don't forget, this is really important, your seasonal influenza vaccine. And then finally, of course, wear a good quality mask when you are in crowded places, buses, trains, supermarkets, etc. An FFP2 mask is what I recommend. And then finally, last bit, your parties and your getting together. If you reduce those exposures in those places where, of course, you're not going to wear your masks, it will be a loud place, you'll be talking in a loud place, then infection can occur in those places. Make your choices and try and avoid them if you don't want to get infected in the next 10 days.
And Bharat, what would be your forecast for the new year if the situation, particularly in England, is unchanged?
I think with the rollout of a massive booster vaccine campaign, it may protect us from having our NHS overwhelmed. But nobody knows. Nobody knows how the new Omicron variant is going to behave and perform. In view of the fact that we don't know, my advice would be careful, take your time, watch this space, because if this Omicron variant is still infectious and you're fully immunized, we may have a problem. So we don't know. We're in some gray area. Better to be careful whilst we wait for more information about it.
But I suppose the government line at the moment is keep calm and carry on. And lots of mixed messages this week. How are people able to move forward and enjoy the Christmas period without worries?
So what I always say is politicians have their own agendas and their own way of communicating, a lot of it by mixed messages, and sometimes deliberate mixed messages, because they don't want to grasp the real nettle. And the real nettle to grasp is person-to-person interactions equals spread of infections. So under those circumstances, what I say is you're all clever, you're all educated, you're all well informed, make your personal decisions. Just because the government says it's okay to go to nightclubs, parties, gatherings, doesn't necessarily mean scientifically it is okay to do so. So now exercise your own personal judgment and make those decisions to keep yourselves safe, despite what the official government line is.
I imagine there'll be some pushback to that line, Bharat. I suppose, you know, lots of young people have had 18 months of lockdowns, of not being able to mingle with friends. What would be your message to them in particular? Because they will say, we have the vaccine, we're doing all we can, and the government say we can enjoy our Christmas as planned?
I always say under these circumstances, because I was also a youngster once, and I remember those sacrifices I made, which were postpone my rewards. And whilst I was swatting away with my books and things to get to university, I always said, good times will arise. And similarly to all the young people, I promise you, really good times will arrive. In the meantime, I want you to remain healthy and well. That is my concern. If you are healthy and well, you've got 50, 60 years of good enjoyment to have and hold politicians to account. So brace yourself, a short-term loss and a great long-term gain. That's the game to play.
Bharat, very strong message there for some of our viewers. What's your message now in closing to the government?
Well, if we act sooner, earlier, extensively, we will get on top of this and we will keep it down. And therefore, instead of fudging certain infection control guidelines, we got to grasp the nettle and say it as it is. Person-to-person interactions equals spread of infections. Therefore, let us do something about it to keep case numbers down and give straight, clear, understandable messages so that most people can follow it, understand it, and keep themselves safe and well.
OK, Bharat, thank you very much. A pleasure talking to you.
Thank you.